Of all the discussion, it is clear that the current border policies this administration has in place are failing terribly. You yourself last week said that there is a need for policy changes, and yet the funding requested in this supplemental will do little to secure our border, and instead, it will throw money at sanctuary cities and inflate our asylum problems even further. What this administration has is a policy problem, or perhaps more appropriately, an implementation of the law problem, not a funding problem. Please explain why Congress should provide you with billions more so-called border security funding if you're just going to keep the same failed policies in place.
Senator, I respectfully disagree with the factual premise of your question. I do not think it is a failure of policy. It is the failure of a broken immigration system. It is also the product of an under-resourced, perennially under-resourced department. This supplemental will assist us in further securing the border by adding critically needed additional personnel and technology. And I will share with you that what we are experiencing is an unprecedented level of global migration, and that is also gripping the entire hemisphere.
Yeah, I think we all know that. I have another question here for Secretary Becerra. Staying on the topic of immigration, Mr. Secretary, your department's Office of Refugee Resettlement is acting in defiance of the Hyde Amendment by using taxpayer dollars to transport pregnant, unaccompanied alien girls across state lines to obtain abortion, clearly acting to circumvent pro-life state laws. Secretary Becerra, how many abortions for pregnant migrant girls has the Office of Refugee Resettlement illegally facilitated across state lines over the past year, and what was that cost to taxpayers?
Senator, thank you for the question. I want to assure you that at the Department of Health and Human Services, we comply with the law when it comes to providing health services or making sure Americans have access to the services. We make sure that we follow the laws that have been passed by Congress, including the Hyde Amendment. And so the services that we provide to those individuals who are within our care through the unaccompanied child program, they will receive health care services, but it's all within compliance within the law.
Okay, if you wish to disagree with me on the legal aspect, let me put it this way. How many abortions for pregnant migrant girls has the Office of Refugee Resettlement facilitated across state lines over the past year, and what was that cost to taxpayers?
So, Senator, we make sure in compliance with the law that if, for example, emergency services are needed for an individual in our care, we would make sure that they provide those services. We also want to make sure that we assist any individual in being able to execute on their rights to have health care services. So
Do you know the numbers?
I can try to get back to you on any precise numbers.
Okay, that's what I'm asking for, is just how much did it cost the taxpayers and how many were there?